All right. Good morning. Good morning. I'm Andrea Ferris, the President and CEO of LUNGevity Foundation, and thank you for joining us today on the Capitol lawn for this powerful and important installation. I gotta be honest, this is the first time I'm seeing it, and I'm blown away. It's amazing. It's wonderful to see so many lung cancer survivors joining us today from around the country as well. If you've ever been diagnosed, please raise your hand and let us recognize you. Thank you. Thank you for being here. Before you are 60,000 white flags and American flags. Each one represents 2 lives lost to lung cancer every year. That is 120,000 Americans, mothers, fathers, siblings, and friends, gone every year from the leading cause of cancer death in this country. Lung cancer claims more lives each year than breast, prostate, ovarian, and kidney cancers combined. Yet it receives a fraction of the attention and a fraction of federal funding. The average 5-year survival rate for lung cancer is now around 26%, thanks in large part to new treatments and research. But that is still far too low. For some communities, including people of color and those in rural areas, it's even lower. And the economic impact of lung cancer is staggering as well. According to a Cancer Trends report titled The Financial Burden of Cancer Care, lung cancer costs the U.S. economy over $23 billion in direct medical expenses each year. This field of flags, it's more than a symbol of loss. It's a call to action, because these deaths do not need to happen. If we invest in early detection and pass laws that promote and expand lung cancer screening, studies shows that we could prevent up to 1/5 or 20% of these deaths. That means saving more than 24,000 lives every year. Lives of people who could still be with their families, their coworkers, and their communities. So today, as these flags ripple in the wind, we're asking Congress, policymakers, and the public to take notice and to take action. We need access to screening programs and care. We need public awareness campaigns. And importantly, we need research funding that matches the scale of the challenge. Each of these flags represents a tragedy, and yet together they represent an opportunity. The opportunity to turn loss into progress and to create a world where no one dies from lung cancer. Let's work together to make that a reality. Thank you. Thank you for being here. And now I'd like to turn the podium over to Dr. Mary Reid, who's come in from New York to speak with us a little bit more about lung cancer screening.
Thank you, Andrea. I'm Mary Reid. I'm the Chief of Cancer Screening and Survivorship at Roswell Park Comprehensive Cancer Center in Buffalo, New York. When I look at this field of flags, we see what the burden in real terms to lung cancer is. But when I look at this field, I also see the potential of lives that can be saved if we increase lung cancer screening. Nationally, only 15% of eligible people are screened with a very simple test of low-dose CT. We have enough CTs, we have enough capacity, and yet we have major barriers from multiple sources that interfere with people uptaking lung cancer screening. These could be lives that we save with a 3-minute low-dose CT. We need the support of our policymakers, of our community, of our medical staff, of our leaders in cancer and in healthcare systems to help us to implement effective screening that reaches everyone who is eligible. I look at these flags and I see people who didn't get screened, but this is whose lives can be saved. We need to see more survivors with early stage lung cancer. The goal of lung cancer screening, it is highly effective, is that we pick up lung cancer when you can cure it. Okay, we need people who speak to the public to eliminate any shame associated with what puts you at risk for lung cancer. We need the infrastructure to make it easy for people in urban centers and in rural areas to access this test. This is critical because this should represent who lives through lung cancer, not represent the folks who succumb to it. Thank you very much.
Good morning, everyone. It's great to see everyone here. Thank you so much for being here. My name is Brandon Leonard. I'm the Vice President for Government Affairs at LUNGevity Foundation, and I have the honor of introducing our next speaker. Congresswoman Debbie Wasserman Schultz is the representative for Florida's 25th Congressional District. During her 20-plus years in the House, Congresswoman Wasserman Schultz has been a passionate advocate for all Americans impacted by cancer. She has introduced and co-sponsored numerous bills that would increase access to cancer care, and she's been particularly focused on the importance of early detection. Earlier this year, she joined Representatives Buchanan, Kennedy, Griffith, LaHood, and Soto as an original co-sponsor of the Lung Cancer Screening and Prevention Act. This legislation would allow for faster Medicare coverage of innovative lung cancer screening tests once they're approved by the FDA. Along with Representatives Reid and Evans, she is also an original co-sponsor of the Mobile Cancer Screening Act, which would allow for federal grants to support new mobile cancer screening units, expanding access to vital screenings in rural and underserved areas. Additionally, Congresswoman Wasserman Schultz has long been a champion for investing in cancer research through the National Institutes of Health and the congressionally directed medical research programs at the Department of Defense, so that we can continue making discoveries that will save and improve countless lives. We're honored that Congresswoman Wasserman Schultz could join us today and look forward to her remarks.
I'm also a Floridian, so I need a coat. Good morning, everyone. I'm really glad to be able to be here. I would love to be able to be here in front of an empty mall in our nation's capital, because we had solved the problem that has devastated so many lives of getting and beating lung cancer. Unfortunately, and I just asked to clarify what each of those flags represents, we have so many people that succumb to lung cancer that each of those flags represents two, not one person, of the 60,000 flags that are out there. So that's 120,000 people who are losing their lives, and the opportunity to be able to make sure that people can get screened to catch lung cancer, and frankly, any cancer caught early, is absolutely critical. We know it saves lives. I want to thank the LUNGevity Foundation for bringing us together for Lung Cancer Awareness Month. And these awareness months might seem, trivial and maybe very surface level, but just like Breast Cancer Awareness Month, that it was recognized last month, and now that we're in Lung Cancer Awareness Month, making sure that we use these awareness opportunities to help people think about their own health and to focus in on steps they can take to ensure the longevity of their life is critical. And it's a powerful reminder about how lung cancer this month, we use this month to remind people how much lung cancer affects so many. And we know a cancer diagnosis doesn't only affect the individual diagnosed, cancer affects the entire family. Our collective mission here today to end cancer as we know it is both a personal and professional goal for me. Some of you know that nearly 18 years ago, I heard the really terrible words, "You have cancer." I was diagnosed with breast cancer when I was 41 years old. And thankfully, because I knew enough to pay attention to my own breast health, I was able to feel a lump just after I had my first mammogram at 40 years old and caught that breast cancer early. I survived 15 months of surgeries and treatment and a very difficult but private battle, but I'm here today to be able to share that with you because of early detection. Thank you. Thank you. But this cancer fight is not new to my family, sadly. During my lifetime, I've lost both grandmothers and my mom to lung cancer. All three were smokers, heavy long-term smokers. Started smoking long before there was really significant understanding about the very dangerous impacts of smoking and, you know, the deception that took place for generations that hooked Americans, hooked people worldwide, and kept them in the grips of addiction until it took their lives. But I do want to tell you something that should give us hope and that should propel more people to make sure that they get screened for lung cancer. Because while I lost my I lost my maternal grandmother in the mid-1970s to lung cancer. I lost my paternal grandmother in 1991. Both were diagnosed and gone within a year and a half of their diagnosis. So obviously not caught early. Fast forward to 2008, and my mom was diagnosed with lung cancer, but she was diagnosed at an early enough stage to where she survived for 16 years with a full and robust life. And eventually, because it wasn't ever in full remission, she always had spots on her lung, but was able to survive without intravenous chemo and the horrific physical complications that causes, and live through my children's entire childhood through adulthood, and to see an additional grandchild be born in my brother's family. And that meant the world to our family, and it just really points to how critical investments in research are. Because in the 70s and the 90s, it really, you didn't hear a lot of stories like that. And we weren't catching lung cancer early enough to be able to have that kind of survival experience. I'm proud that my experience and all that my mother and grandmothers went through has helped me translate our family's health challenges into something even greater, and use my platform and our personal experience to be able to help make sure that we can keep human faces. I mean, these are 60,000 flags, but they represent 120,000 real people who lived lives, rich and full lives, who were taken unacceptably too soon. And that through screening, we can have the kind of longevity that so many need, and even now defeat lung cancer in real people. For my entire professional career, going back to my days in the Florida legislature, I've always been a strong advocate for early detection, prevention, survivorship, and education. And critical among that list of priorities is the importance of enhancing, expanding, and protecting access to early screenings. It's by far and away one of the best tools that we have to beat this disease. And this killer, we know, ignores gender lines. Lung cancer is the second most common cancer in both men and women. Close to 226,000 people will be diagnosed with lung cancer this year, and diagnoses and deaths have increased at a faster pace among communities of color. It also has one of the lowest 5-year survival rates still, due to cases so often being diagnosed at later stages when cures are out of reach. And again, this is often more true for communities of color. But there are hopeful signs to be found. Lung cancer survival rates have improved 26% in the last 5 years. And while we have effective screening methods for this terrible disease, as you heard, screening uptake remains very low. I will be honest with you, until a few years ago, I didn't even know that there was a screening test for lung cancer. I mean, if I didn't know, then you know how many people don't know about this opportunity that's critical, where we can have proven ways to shift late-stage diagnosis to early-stage diagnosis. So when we catch this disease earlier, it's more treatable, less expensive, or invasive to treat, and we know the playbook, we know what works, and we must do better. That's why I've introduced the Comprehensive Cancer Survivorship Act, so we can make sure that the challenges that people face when they've been all the way through a cancer diagnosis and on to survivorship, we need to make sure that everyone has the same kind of support that they can utilize to be able to stay healthy and cancer-free. And it's also why I championed the legislation that I'm proud to say is now law, the LCL Hastings Program for Advanced Cancer Screening in Underserved Communities Act, because we need to make sure that we're focused on where the most difficult part of our challenges are. This has been an extremely challenging year for the cancer community. We've seen startling cuts to vital health research, and even our critical NIH and CDC budgets have been slashed. I saw it up close because I sit on the Appropriations Committee as a senior member, where earlier this year we considered the very bill that funds the CDC. And unfortunately, the Republican-authored bill eliminates funding for the CDC's Office on Smoking and Health, the only federal office devoted entirely to reducing tobacco use. And all of us know how critical this work is intimately to reducing the prevalence of lung cancer. I offered an amendment to try to reverse this terrible policy, and it was defeated on a party line vote. And right now we're in the fight for our lives with the extension of the ACA tax credits that provides literal life-saving healthcare coverage for cancer patients. So we already have the difficulty and challenge of getting people to be aware of the opportunity to get screened for lung cancer. If you don't have healthcare coverage, then you're not going to be able to have access to that because you won't be able to afford the cost of it. And there's no copay if you don't have healthcare coverage. So we cannot create an exacerbated situation where cancer diagnoses are delayed, where you have more complicated results, and we have to make sure that we avoid more costly life-threatening treatments. Everyone should be able to live like my mom was able to, even while living with lung cancer, and have a robust, even knowing that eventually she would lose her life to lung cancer. The fact that she was able to, through research, through attentive healthcare, and the ability to be able to get that kind of access, that should be universally available to everyone. Thank you so much to LUNGevity.
Thank you, Congresswoman. I'd like to now ask Neal Augenstein, our lung cancer survivor and reporter for WTOP News, to come up to the podium.
Hello, everybody. Thank you for being here. What a pleasure it is to be here and to speak with you this morning. Thank you for being here. My name is Neal Augenstein, and for the past 28 years, I've been a reporter with WTOP, which is Washington's all-news station. 3 years ago, in November 2022, after a persistent cough, a suspicious X-ray, and a concerning CT scan, I was diagnosed with stage 4 lung cancer. But I've been lucky. By taking a 1 pill a day targeted therapy, within 4 months, almost all of the cancerous lesions and lymph nodes in both of my lungs were gone. And that made me eligible for a robotic-assisted lobectomy. 6 months after being diagnosed with the most deadly cancer in the U.S., I was cancer-free. And I've stayed that way since May of 2023. Thank you. I'm still taking my 1 pill a day targeted therapy, haven't missed a day of work, and I'm enjoying the life with my family that I led before my diagnosis. Back then, I wasn't aware that November was Lung Cancer Awareness Month. I wasn't aware that something called biomarker testing could analyze tiny pieces of tissue from my biopsy to help determine the exact gene mutation that caused my cancer. But here's what I did know. I had a wonderful forward-thinking oncology team at the Inova Shar Cancer Institute, and I discovered incredible resources like LUNGevity, providing accurate information for patients and caregivers. Since then, I've become aware of clinical trials that pair different drugs to help patients live much longer and with far fewer side effects. I'm now aware of research to overcome the fact that even my powerful, usually gentle targeted therapy can stop working over time. And just recently, I was thrilled to hear the results of a clinical trial that I didn't even know existed, but it guided my team's belief that I had become a good candidate for surgery. The North Star trial found that adding surgery or radiation to my 1 pill a day targeted therapy helps patients live 75% longer than those who take the pill alone. And it reduces the risk of dying by nearly half. I'll take those numbers anytime. And so, as a lung cancer patient who happens to be a news reporter, I want to say thank you. Thank you to the researchers, the advocates, and organizations like LUNGevity. Your dedication to understanding lung cancer, developing new treatments, and advancing earlier screening methods is empowering patients like me to look forward to a long, healthy life. Thank you.
Thank you, Neal. That was amazing. I'd now like to invite Dr. Michael Gieske from St. Elizabeth's Healthcare in Kentucky to join us up on the stage.
Thank you very much, Andrea, and thank you, Congressman Wasserman, Schultz, and Neal. Those real-life examples add so much credence and value to the work that we all do, and it's not easy to be an advocate, and we very much appreciate what you bring to this cause. Standing among these 60,000 flags, each one of which represents 2 lives lost to lung cancer, 120,000 lives, you can't help but be impacted by the gravity and the weight of that loss. But also, it brings us all together. It unites us in this cause, in this effort to improve lung cancer awareness, to improve lung cancer screening awareness, and to hopefully make a tremendous difference in the long run. What we don't see here today is just as important. 10 years ago, there would have been 30,000 more flags out here. 60,000 lives lost to lung cancer 10 years ago that are no longer here. These are individuals that are going to be able to see their children get married, to see their grandchildren born, to sit at holiday tables and to celebrate life and love with their family. We are making a difference. We've begun to rewrite the story of lung cancer, and this happens through a number of different channels. Policy has improved. Smoking rates have precipitously declined over the last several decades. We've made amazing progress in surgery. We now have very targeted, specific radiation treatments. Our diagnostic workups have improved, and the pharmacological advances have been astounding. We have mutation-specific targeted drugs. We have immunotherapy. We have antibody drug conjugates, bispecific T-cell engagers. You know, the list is growing longer every day. AI has become part of the equation. We now use AI to track and follow patients. We use AI to help improve the screening so that we can reach others that don't only have a history of smoking, but eventually we'll be able to screen for those without a history of smoking. We know that radon causes lung cancer, air pollution, family history is involved. There's a number of factors that eventually will have very complex AI-directed algorithmic approaches to screen those folks as well. Lung cancer screening has also been a huge part of the progress that we've made in reducing the mortality from lung cancer. I'm a family physician. I've been in practice for 39 years, and far too often I've seen the devastating impact of lung cancer on my patients and their families. I learned about lung cancer screening about 10 years ago, and the difference that it can make, the hope that it can bring to our patients that are at risk for lung cancer. Our healthcare system made a concerted effort at that time to improve our lung cancer screening approach, and we've now screened over 56,000 patients for lung cancer. And it's not just the number that's important, it's the results that we're seeing. We are now finding one lung cancer for every 24 unique patients that we screen. This year, we're finding 76% of the lung cancers that we found in stage 1. 80% are in stage 1 and stage 2. We are truly making a difference, and we are truly saving lives. And the other part of this equation is that even when you find lung cancer in stage 3 and stage 4 in the late stages, this science has evolved to the state that we now are able to make such a difference with even late stage lung cancer. We now have patients with stage 3 and stage 4 lung cancer, as Neal has evidence, that are 5, 10, 15, 20 years out with no evidence of disease. They can't find it. But screening rates still remain inexcusably low. I just, on the way over here today, the American Lung Association puts out the state of lung cancer every year. This is hot off the press. The screening rate for lung cancer in our country is 18%. That pales in comparison to breast cancer screening, colon cancer screening, and cervical cancer screening, which have rates of 70 to 80%. We can do better, and we need to do better. We need to expand our screening criteria so we can capture folks that don't have a history of smoking, that have other risks for lung cancer, including family history. Primary care plays a very important example. I can't overemphasize the importance of engaging our primary care providers. Policy plays an important role. Research plays an important role, and we've touched on that briefly already, but we need to improve the lung cancer research program that's part of the CDMRP. It's presently funded at $20 million. We need $60 million at least to cover 100% of the highly qualified research programs for lung cancer research. We can't continue to make this dramatic progress without research. Together, we must continue pushing forward and expanding this research so that everyone can get the same equitable and fair treatment that need it most. In conclusion, I want to say that something else is very different here today. There has been a deafening silence for decades when it comes to lung cancer. This silence is fueled by stigma, nihilism, and fatalism. But that deafening silence is being replaced by a growing army of survivors, many who are here today. That deafening silence is being replaced by survivors and advocates that together are fighting against the stigma and the nihilism and the fatalism that lung cancer is plagued by. They're adding dignity and hope to lung cancer. This is hope made visible. God bless all of you that are here today and united in this effort. Together we will continue to save lives. Together we will continue to make a difference and bring hope. And together we will all work collectively so that someday we will assure that displays like this are no longer necessary. Thank you very much.
Thank you, Mike. I'd now like to invite Cherry Ann DiGiulio, our lung cancer survivor, advocate, and absolute friend, just a treasure. She is also a member of the board of directors of LUNGevity Foundation. And like Neal is, a perfect display that anyone with lungs can get lung cancer.
Good morning, everyone. I am thrilled to be here today. As Andrea said, I'm a lung cancer survivor. I've been diagnosed with early stage lung cancer 3 times over a 20-year period. I am also a member of a multi-generational lung cancer family. 6 of us in my family have been diagnosed with lung cancer. 2 of us were diagnosed at an early stage. 2 of us are still alive. None of us had symptoms, and many of us were not eligible for screening. My first diagnosis was an incidental finding. It was discovered by complete chance in the emergency room. I was 42 years old when it was found, and I was 44 when I had the lower right lobe of my lung removed and received my diagnosis. Because of that experience, I remained under close follow-up, and my second diagnosis came 11 years later. The treatment that was offered to me then, SBRT radiation, was not even an option the first time around. This radiation allowed me to keep the remaining part of my right lung, and it also allowed me to avoid another invasive surgery. Now, my third diagnosis, as if that wasn't enough, came just 4 years ago. And once again, advances in research profoundly impacted that outcome. During my third surgery, I participated in a clinical trial for an imaging agent that was going to be used during surgery. That imaging agent helped my surgeon find and remove not only the primary tumor, but a second tumor that did not show up on any of my scans. Both tumors were malignant. Imagine where I'd be today if it wasn't for research. I've seen firsthand the progress that's been made, and it's never lost on me that what was available to me was not available to my family. And yet, we are still losing 120,000 lives every year to this disease. Every year. More needs to be done. And that's why I'm here today, and that's why I participated in this flag installation over the weekend with many people that are here today. I'm able to live this amazing, active, fulfilling life, even though I was diagnosed and treated 3 times for lung cancer. In January, I get to celebrate my 65th birthday. This is what early detection looks like. But unfortunately, I'm not the norm. Too many people their lung cancer is discovered at a late stage when treatment options are more limited, and that just shouldn't be the case. We need research funding not only to develop better treatment options, but to create better, more accessible detection tools, to find lung cancer earlier when it's most treatable and when people have the greatest chance for a cure. We also need to expand lung cancer screening criteria, as Dr. Gieske mentioned. So right now, even a family history like mine doesn't qualify someone for lung cancer screening. Anyone with lungs can get lung cancer. We need more outcomes like mine. We need to save more lives. Thank you.
Okay, for our final speaker today, I'd like to invite up Dr. Matthew Shabath from Moffitt Cancer Center.
I don't know how I'm going to follow up with all these amazing presentations, but I'm glad the recurring theme was talking about research today, because that's what I'm here to talk about. So I'm Matt Shabath from the Moffitt Cancer Center in Tampa, Florida. You're welcome for this weather. I packed it on an airplane this morning and brought it with us from Tampa. I'm a senior member in thoracic oncology, and I also run our lung cancer research program dedicated to early detection of this disease. I've spent 25 years entrenched in lung cancer research. When I started this 25 years ago, early detection was a pipe dream. We were mucking around a lot of different areas, and we fast forward now today to almost 2026. We have this life-saving modality. Unfortunately, as we've already heard, very few people are getting screened for lung cancer, and we have to do better on that front. But I want to talk about research and investments of what the NIH and National Cancer Institute has done to really transform the way we detect this disease early, and the investments that these foundations from the NCI and NIH have made huge inroads. Over the last 13 years, my team has focused on harnessing AI. I'm glad we talked about AI already, because this is happening in real time. Institutes, cancer institutes, universities are investing heavily into this because it is making a difference. And my lab has been focused on in ways to improve lung cancer screening. While lung cancer screening is a life-saving modality, it is not without its challenges. We screen people, about up to 48% are going to be detected some sort of nodule. Only about 4% of those will go on to be lung cancer. Another challenge is current guidelines recommend that people get screened on an annual basis. But what if somebody's at a very ultra low risk? Can we move that to every 2 years or every 3 years? Save money, save time, but also save that exposure to the radiation in a CAT scan. And additionally, these CAT scans are so remarkable and so precise. We can detect nodules and cancers when they're very, very small. The problem is, if we're detecting very small cancers, we don't know what this flavor of lung cancer is. Is it a lethal, aggressive cancer that we need to take into surgery and intervention right away? Or can we follow what other diseases do and use a wait and watch approach? So to address these issues of lung cancer screening, my lab at the Moffitt Cancer Center has spent, as I said, over 13 years using AI to address these challenges. We can analyze a medical image, a CAT scan, and patient data, run this through an AI algorithm, and we can actually differentiate between cancer and non-cancer nodules. We can detect it earlier, faster, cheaper, and non-invasively. We can also use AI to determine those small, tiny little lung cancers. Is this a lethal cancer that we need to act on right now? Or can we, again, use the wait and watch approach? Overall, when this research reaches patients, it's going to allow lung cancer screening programs in the US and around the world to provide personalized care to patients, to allow for precise management and follow-up of patients in these programs. It sounds like science fiction a little bit. Sometimes I believe it is, but it is science, 100%. And I want to really emphasize this research would not have happened without what's happening, without the funding that we get from Washington, D.C., from the National Cancer Institute, from the National Institute of Health. I want to really plug two important networks, the NCI Early Detection Research Network and the NCI Quantitative Imaging Network. With respect to the NCI Early Detection Research Network, EDR, and this has been in existence for 25 years. This has been the the front of lung cancer early detection, as well as other diseases. In fact, this network has brought bench to bedside for early detection for numerous cancers, including lung cancer. And importantly, these studies that were originally funded by the NCI, by a couple labs at my Cancer Institute, has evolved from 2 grants to 4 grants to 8 grants and so forth. Eventually now our entire institution is completely embedded in AI research, bringing AI to personalized care, to include clinical workflows, and of course, to improve cancer research. In fact, we founded one of the first machine learning departments in the country in an NCI designated cancer center. So finally, I do want to just briefly echo my messages of my colleagues who presented today, that we have to make sure more people are getting into these CAT scans. We want to reduce barriers. We want to increase access. And importantly, what was mentioned, awareness, because people aren't aware that this life-saving modality is out there. As already mentioned, less than 20% of eligible people are getting screened for lung cancer. In some states, it's as low as 9%. We must do better. We must break down these barriers to access so all people who qualify lung cancer screening can get it. Thank you very much for this opportunity.
So that brings a close to today's press conference. And I just want to thank everybody who is here and who is watching through Facebook Live as well. I think you've heard from a number of people to really demonstrate the impact of this disease. And we have a visual representation of the devastation that it causes to families, but also have heard about the hope and the ability to change that. And my hope is that as time goes on, these flags will become smaller and smaller, and we will have a much less display. I'd like to draw attention, which we did not mention, is the American flags. And those actually represent the 5,000 servicemen and women, veterans who die from lung cancer every year. And veterans are actually at a 30% increased risk for lung cancer. So let's not forget our servicemen and women who also are impacted by the disease, and we can do much better, not just for the country, but for them as well, and who serve. So thank you for that. And, you know, you've heard from Terry Ann and from Neal and others, and as we say, anyone with lungs can get lung cancer. As you walk around, and I encourage you to do so, there is educational signage, but one of the signs that you'll see as well is that 65% of those diagnosed actually have no or very, very limited tobacco history or have stopped smoking years and years ago. You do not need to be a smoker to get lung cancer. Actually, many of the survivors who are here with us today have no smoking history, no tobacco history. And that is something that is not well understood in this country. And as a consequence, it contributes to the stigma that Dr. Gieske had spoken about. But it also gives us a call to action to make sure that we have ways of detecting and finding those people earlier, because currently we don't, and we need to. And it should not be by chance that somebody goes to the ER and says, oh, by the way, you have lung cancer. That just should not happen. So with that, I'm going to repeat what I had said before in terms of what we are asking for. And we are asking Congress and the policymakers and the public to take notice and to take action. We need access to screening programs to get those screening rates up. We need access to care. We need public awareness campaigns. And importantly, we need research that matches the scale of this challenge. So thank you all. And I hope that you participate in Lung Cancer Awareness Month and help us spread the word. So thank you.